Please welcome President of Johns Hopkins University, Ronald J. Daniels.
Good morning. Good morning, good morning. It's great to see you all here. Thank you, Mike, for your moving words and your enduring and indeed truly visionary support for this initiative. Josh and Michelle, a comedy team. Who would have thunk it? Don't leave your day job. These guys truly have been amazing in terms of the energy, the imagination, the irrepressible enthusiasm, the attention to the small details while driving a big agenda. You guys are extraordinary, and I just, again, on behalf of all of us, want to thank you for your incredible, incredible leadership of this initiative. So, officially, I'm delighted to welcome you all to the 6th annual Bloomberg American Health Summit. From its earliest days, the field of public health has been defined by the connections its practitioners have drawn. Connections between facts and theories, between biology and society, between people and policy. Now, a perfect case study, and I love the case studies. There are so many wonderful case studies you can draw from the history of public health in this country and beyond. But a perfect case study of this began in 1906 as a mysterious and deadly disease known as pellagra swept through the American South, eventually affecting more than 3 million people and killing nearly 100,000 people. Symptoms of the disease included debilitating skin rashes, gastrointestinal inflammation, and even dementia. The disease had plagued European farming communities for nearly 2 centuries, but its origins continued to baffle the scientific and medical communities. By the time it arrived on American soil, many experts believed that pellagra was, to quote one of them, a sphinx of which we have asked a reply and gotten none. Enter Joseph Goldberger, a physician in the U.S. Public Health Service. Goldberger was the first person to successfully recognize that cracking the Sphinx's riddle meant looking for connections between pellagra and social determinants of health, like poverty and nutrition. He discovered that those who suffered from the disease also lacked nutrients, like niacin. Pellagra was not only treatable, but indeed preventable. But to ensure that this disease was prevented required that his findings be connected to public policy. Those who followed in Dr. Goldberger's footsteps helped link his insight to a suite of national campaigns and federal policies, including the widespread enrichment of flour and other food products with niacin and the first dietary recommendations for daily nutrients. Today, pellagra has been virtually eliminated from the developed world. Its near eradication is evidence of the power of public health practitioners to connect biology and medicine to a range of interventions and policies for a flourishing, for a healthier society. This example, this ethos, lies at the very heart of the Bloomberg American Health Initiative. Since its founding, we have connected more than 300 fellows, over 100 alumni, and over 260 organizations across fields, disciplines, and regions to solve seemingly intractable problems. The sphinxes, so to speak, of addiction and overdose, climate change, adolescent disconnection, violence prevention, and our nation's food system. And now, thanks to the newly opened Johns Hopkins University Bloomberg Center at 555 Pennsylvania Avenue in DC, we're able to advance this work at even greater scales as we bridge brilliant evidence-based scholarship and interdisciplinary collaboration with impactful policymaking that serves and sustains our hope for a more equitable, a more just, a healthier world. I'm proud that Johns Hopkins, working alongside our partners at Bloomberg Philanthropies, is able to support this vital work together with your leadership, with your energy, with all the work that you're doing. We will continue to forge new and uncharted connections that will reshape the course of public health in the 21st century. Thank you all for being here, and enjoy the summit.